Confessions of a Midwife.
Hi, my name's Diane, but you can call me Di. I'm a women's health physiotherapist, and I'm here to talk to you about the female pelvic floor and the female pelvic floor muscles. So this is a pelvis model. This is the pubic joint at the front, the bony bit that you can feel just under your belly button. And when we turn around in the back, those are your two sacroiliac joints, those little dimples that you can feel in the back. And the spine comes down, and the spinal cord runs inside that bony cage of the spine. Leaving this sacral holes 2, 3, and 4 are the nerves that go to your pelvic floor. Everything in red, from the tailbone to the pubic joint, and from the sit bones, are your pelvic floor muscles. The pelvic floor muscles wrap around the anus or back passage. They crisscross at the perineum, and then they wrap around the vulva, which includes the vagina, the urethra, the clitoris, and then the labia or lips of the vulva. So everything you see in red are pelvic floor muscles on the outside, and they're in between your legs. When you look inside the pelvis, everything in red up inside of that pelvic model, those are the internal pelvic floor muscles. So you have 2 layers, one on the outside and one on the inside. You can see your pelvic floor muscles if you look with a mirror, but you don't have to. Here's how you find them. Sit comfortably. Relax. Take a tiny breath in and out. And then pretend you don't want to pass wind and gently close your back passage or close the anus. Or as I've been taught by some other physios that specialize in women's health, pretend you're picking up a blueberry with the back passage and giving it a squeeze, and then gently put the blueberry back down. I've probably ruined blueberries for you forever. And then you progress the exercise. So you go like this. Breathe in and out. Close the back passage. And then now move that exercise to the front where the vagina is, as if you're trying to close the curtains of the vagina. All right, so it's a small breath in and out. Gently close the back passage or pick that blueberry up and give it a squeeze. Move the squeeze to the front where the vagina is and close the curtains of the vagina. In general, if you have a weak pelvic floor, or you have pain in your pelvic floor muscles, or you're leaking urine, or you're leaking wind, or you're having problems controlling your bowels, you should exercise your pelvic floor muscles 123 squeezes a day for at least 3 months until your symptoms improve. So that would be 10 short squeezes 6 times a day, and a short squeeze we've already practiced. Breathe in, breathe out, squeeze back to front, and gently let that go. A long squeeze, well, what's a long squeeze? How long's a piece of string? A physio loves the number 10. So if you can squeeze your pelvic floor muscles while breathing in and out for at least 10 seconds, that's a good long squeeze. Now, why do we say 10 seconds? Well, there's a training effect to your pelvic floor muscles. And when you hold an exercise for between 8 to 12 seconds, that's a good training effect or a good strengthening effect to the muscles. We just land in the middle at 10, but you can hold them longer or shorter. If you don't like the number 10, go for 9. If you prefer 11, go for 11. And then I said 123 squeezes a day, right? You want to do 3 sub-maximal squeezes, or real feather-light, gentle squeezes that you hold for at least 20 seconds. Because think about it. How long does it take for you to get from the car door to your toilet? About 20 seconds? So that would be good endurance training for your pelvic floor muscles. And on that note, The pelvic floor muscles are broken down into two types of muscle fibers. Well, maybe more muscle fibers, but in general, two types of muscle fibers. Endurance, slow twitch muscle fibers, and 70% of the pelvic floor muscles are the slow twitch muscle fibers, which means 30% are the sprinters. So you want to focus or concentrate on doing more of the slow twitch or long holds than the quick ones, although the quick ones are easier, and they're usually the ones that patients prefer to do, or people prefer to do. So make sure you're getting your long squeezes in. And the other thing about long squeezes that's very important is you want to breathe in and out while you're doing the exercise. So don't hold your breath. And a lot of people will say, oh, Diane, as soon as I let go of my breath, I let go of my exercise and I let go of my muscles. It takes practice. You're not going to get it perfect in one go. And remember, it's a marathon you're training for if you're a pregnant person. And you don't walk out the door and run a marathon. You slowly train your muscles and increase how long you train them for day by day. And if you're a postnatal person, it's also a marathon to get back to doing everything in life that you were doing before you were pregnant. So give yourself 1 year and 3 months to recover from having a baby, because it doesn't take 6 weeks to recover from having a baby, no matter what anybody tells you. It doesn't take 6 weeks to recover from having a total hip replacement, no matter what anybody tells you. It takes a good year and a few months to recover. So keep training your pelvic floor muscles gently, comfortably, but breathing. And then you want to take your exercises from sitting and lying to standing and walking and jumping, and while you're picking your baby up and while you're putting your baby down, and before you cough and before you sneeze, before you get out of bed, before you do anything. Speaking of doing anything, the other thing that's really good to stimulate pelvic floor muscles is having sex. Because while you're having sex, there's something to squeeze on, and there's someone who can tell you if they can feel the squeeze or not. So pelvic floor muscles are stimulated by having sex and also by having an orgasm, however you have an orgasm, whether that's through manual stimulation or penetration or both. So remember that sexual function is part of what the pelvic floor muscles do. So if you have any questions, you can always ask Confessions of a Midwife. And my name's Diane. Thanks.